Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is family medicine provider, Dr. Erica Yates. Thanks for joining us today.
Thank you. I'm glad to be here.
So today's topic is obesity treatment, but first, tell me how you define obesity.
The simplest way to define obesity is by the BMI, or the body mass index. And if the BMI is over 30, then you are considered obese. But you have to consider that some people are bodybuilders and have a lot of muscle, so their BMI may be high, but they may not be obese. But we use the waist circumference to help. If females have more than a 35-inch waist, males have more than a 40-inch waist, they are definitely considered obese.
What are some of the risks to our health with obesity?
In general, when you have a BMI over 30, you're going to have 4 times the risk of a healthy BMI with cardiometabolic issues. And if you have a cancer and your BMI is over 40, you're going to have about 50% more mortality. So this is really serious. The obese patient has higher risks of hypertension, heart disease, fatty liver, sleep apnea, arthritis, and many other issues. If you would lose just 1 pound, it can take 4 pounds of pressure off your knees. And if you can lose 10% of your body weight, that will greatly reduce your risks for a lot of these metabolic consequences.
With it being that important, tell us how we can treat obesity.
I like to think of it in 5 ways: diet, exercise, behavior, medications, and surgery. Everybody knows about diet and exercise, and the problem is that I've treated patients, including myself, who have tried so hard with diet and exercise and they still cannot maintain their weight. So I like to look at behavior modification also. Things like eating off a smaller plate, keeping up your steps, stress reduction, getting adequate sleep, having accountability partners. All of those things help, because the only way you're going to lose weight is to make it a lifestyle. But then there's medications, and the medications are really helpful. I really think the new hot thing is the GLP-1s. Those really work, and people tend to lose a good amount of body weight. And then there's surgery. Surgery probably has the best outcomes, and we have a great surgeon here who does the gastric sleeve. And the gastric sleeve, they tend to lose 80 to 100 pounds, but I think everyone has to look at all 5 and see what will work for them.
Great. Well, thank you.
Thank you.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from the providers at MRHC in Corinth.